So here is information about our case study. So Mr. Weber presents, he's a 42-year-old male. He presents to his to the primary care clinic. He sees his nurse practitioner. He's been having signs and symptoms for 1 week, but he has had these symptoms recurrently over the last 6 months and has had visits previously for similar issues. So he's been having new onset of fever, some tiredness, fatigue. He has low back pain and perineal pain. He also has pain with urination and nocturia times 1 week, and then a new onset of pain with ejaculation. Again, these are recurrent issues, and he does have, as far as pertinent medical history, a history of smoking. He has a 15-year PAC history, although he did quit last year. He works currently as a contractor for residential homes. He is single. And some of his medications that he currently takes are fish oil, some vitamins, vitamin D. He takes the naproxen PRN over the counter for his back pain, and he also takes lorazepam PRN for anxiety. He does have a history of a stomach ulcer from 2018 in which he takes omeprazole. Our physical exam findings for Mr. Weber reveal fairly normal vital signs. He had blood pressure of 115/75. His heart rate was 94, respiratory rate 18, and his temp was slightly elevated at 102. And we would expect a mild temperature with his condition since it's a bacterial infection. Mental status, he's alert and oriented, pulse is regular, skin is warm and dry. His lungs are clear to auscultation, no wheezing. We wouldn't expect him to be having anything wrong with his lungs unless there's some type of secondary infection. His heart rate is normal. He doesn't have any abnormal rhythm, and his abdomen is soft and non-tender. We would expect palpation of the organs to be normal, and we would not expect to be able to palpate the bladder. That could be a positive indication of a different issue related to his bladder. His urological exam showed, in which a prostate and digital rectal exam was done, showed a larger than normal prostate. So this is an abnormal finding. There were no nodules that were palpated, but pain and tenderness also was noted by the patient on exam, which is, again, another abnormal finding.